When most Americans hear the phrase government health care, they often picture one thing: a government program that collects the money, owns the hospitals, employs the doctors, and makes the decisions. Germany challenges that assumption. Germany's healthcare system is not socialized medicine in the traditional sense. The government does not own the healthcare system, it does not employ most doctors, and it is not the single entity paying every medical bill. Instead, Germany uses what is called a regulated multi-payer system. At its core is a simple idea: everyone should have health insurance, but the insurance itself does not have to come from one government-run plan. Health insurance has been mandatory for all residents since 2009. Roughly 9 out of 10 Germans receive their coverage through what are called statutory health insurance funds, often referred to as sickness funds. These are generally non-profit organizations that compete with one another for members. The remaining portion of the population, primarily higher income earners above a certain income threshold, many self-employed individuals, and most civil servants, can choose private health insurance instead. That distinction is important. Germany does not say, everyone gets the same government insurance card. Instead, it says, everyone must have insurance, and the insurance system must operate under national rules. How the money works. This is where the German system begins to look very different from the American system. For most workers, health care is financed through payroll contributions. Employees and employers share the cost, with contributions based on income rather than an individual's medical risk. The money does not simply stay with the insurance fund that collected it. Instead, contributions flow into a central national pool. From there, money is redistributed back to the individual sickness funds based on the health needs of their members. Why does that matter? Because without this system, competition between insurers could quickly become a competition to find the healthiest customers. A company might try to attract young, healthy people while avoiding older patients or people with expensive medical conditions. Germany's risk adjustment system is designed to prevent that. The goal is for insurance funds to compete based on service, efficiency, and patient satisfaction, not on how successful they are at avoiding people who need health care. 2 paths: public insurance and private insurance. Germany actually has 2 insurance pathways. The statutory system is based on solidarity. People contribute according to their ability to pay, and everyone covered receives a broad package of benefits. Private insurance operates differently. Premiums are generally based on individual risk factors when someone joins, such as age and health status. Private insurers also build reserves intended to help cover higher costs later in life. That creates a different set of trade-offs. Someone younger and healthier may find private insurance attractive because it can offer different options or pricing. However, as people age, healthcare costs generally rise, and changing insurers may become more complicated because a new insurer evaluates the person they are today, not the person they were when they first entered the system. Again, the point is not that one approach is automatically better. It is that the systems operate under different philosophies. Who actually runs healthcare? This is probably the most misunderstood part of the German model. The German government establishes the legal framework, sets broad rules, and oversees the system. But it does not directly manage every decision. Many day-to-day decisions about benefits, quality standards, and payments are handled through a system of self-governance involving representatives from insurance funds, doctors, hospitals, and patients. This approach has historical roots dating back to the 1880s under German Chancellor Otto von Bismarck. That history is worth noting because it challenges another common assumption. Germany's healthcare system was not created as an attempt to create a government-run medical system. It developed from a social insurance approach designed to provide workers with security and stability while maintaining a role for private providers and organized insurance groups. The German model, in simple terms, Germany combines mandatory universal insurance coverage, multiple insurance providers, private doctors and hospitals, government regulation, income-based financing, competition between insurers rules designed to prevent insurers from avoiding expensive patients. It is neither a fully government-run healthcare system nor a completely free market system. It sits somewhere in between, and that is precisely why it is useful as a point of comparison. When Americans debate healthcare for all, Germany reminds us that the debate is not simply a choice between government healthcare and private healthcare. There are many possible designs. The real questions become: who pays? Who provides the care? Who sets the rules? Who takes the financial risk? How much choice should patients have? How much responsibility belongs to government? And how much belongs to the private sector? Those questions will become increasingly important as we look at the other models. You will find a handy table in the accompanying text.